Minister, as you are aware, the HSE National Service Plan for 2012 includes a commitment to roll out a new kind of treatment for diabetes in children, including the use of insulin pumps. And 5 centres were identified, 3 in Dublin, 1 in Cork, and a shared service between Limerick and Galway. And the target date was the end of Q3, in other words, the end of September. There are 2 main issues here. One is the restriction of the new insulin pump treatment to children under 5 years of age, and the other is the discrepancies in treatment for children across the different regions of the country. Now, one often hears complaints about a Dublin-centric attitude, and as it stands at present, where where children are seen by a consultant from Galway, they have to travel at present up to Temple Street, maybe 6 or 7 times a year for this technology of the insulin pumps and for checking, etc. As a TD for Galway, I want to speak about the regional deficiencies, and whilst I warmly welcomed the announcement earlier in the year of an additional 1.2 posts of a diabetes nurse specialist for Limerick and Galway, with a diabetes dietitian also shared between the Mid-Western Regional Hospital and Galway University Hospitals. These posts were to be filled and operational by June 2012. This did not happen. Following representations and a delay of several weeks, I received news this afternoon, by strange coincidence I'm sure, that these posts will be advertised in the coming weeks and will be in place by the start of 2013. Despite the delay, I obviously see the benefit for this, and speaking to advocacy groups, they state that Galway is the poor cousin when it comes to urban areas in terms of diabetic treatment. However, this good news does not solve another aspect of the issue, that is the apparent differentiation between age groups. The new insulin pump treatment will only be introduced to children under the age of 5, so I'm concerned about those greater than 5 years of age. I have a constituent who came to me on behalf of his daughter, who is 11, and this girl requires between 4 and 5 injections per day of insulin, and that has been going on for a number of years for type 1 diabetes. And obviously this is an amount of trauma to the body, so much so that starting in the abdomen there has been an amount of marking and bruising. They then proceeded to give the injections on her arms, and subsequently that has caused bruising as well, and now they're on the back giving injections on the back of her legs. So this is obviously a huge concern to this girl, to her parents, and they want to know when they might have access to an insulin pump. She is 11 years of age, she is in Galway, and will it be something that she'll have to continue, or that this treatment will only be available in Dublin? So it's a huge regional issue, and obviously no one likes to talk about the healthcare and its costs, but we need to be practical, and we must use the funding to allocate healthcare to the optimum use. We need to realise that by not extending insulin pump treatment to all children, that we will be penny rich and pound foolish.
Thank you, Deputy Minister.
I am going to deal with this issue on behalf of the Minister for Health, Deputy James Riley. The Health Service Executive's National Clinical Programme for Diabetes, which includes the care of children and adolescents with diabetes, was established to define the way diabetic clinical services should be delivered, resourced and measured. The programme is led by a clinician, and its central aim is to save lives, eyes and limbs of patients with diabetes. The National Clinical Lead for Diabetes and Paediatrics met to discuss the issues involved in the care of children and adolescents with diabetes. A working group was established to discuss services across the country, to agree a model of care and to standardise these across the country. Their work involves the development of criteria for the use of insulin pumps therapy in children and adolescents with type 1 diabetes, as the benefits of this form of therapy are well established, particularly in children less than 5 years of age. They also work on policy to aid the early detection and prevention of diabetes in young children and adolescents, and this group's work is ongoing. I am delighted to say that this year the HSE Paediatric and Diabetes Clinical Programme initiated a project to provide insulin pump therapy to children under 5 years of age with type 1 diabetes in 5 centres nationally. This is a wonderful advancement in the treatment of children with diabetes. The centres include AMNCH, Crumlin, Temple Street, Cork, Limerick and Galway. All children under 5 will be assessed for suitability for insulin pump therapy in one of these centres. If suitable, the children and parents, carers or their carers will undergo a structured educational process prior to commencing insulin pump therapy. If not found suitable, children will be treated using multiple daily injections. The diabetes team will work with the parents and children to address the deficits if desired. All insulin pump therapy commenced in children under 5 years of age will be maintained in the over 5 age group. In order to provide this treatment, additional nursing resources are required and work is progressing in relation to the recruitment of these nursing resources at present. I am fully aware of the challenges facing young diabetic patients and of the need to support those patients and their families, and I am committed to providing the best possible health service for our children and their families, and will continue to work with the HSE and specifically the clinical programmes to ensure that the best possible outcomes for these patients.
Thank you,
Minister.
Deputy. Deputy Kyne,
thank you, Minister. Whilst I welcome the announcement that I received today regarding the therapy service to be operating jointly between Limerick and Galway, and that these posts should be in place by 2013, there is a recruitment programme commencing in Manor Hamilton for these positions. It still leaves, and it's also welcome in your response, that all insulin pump therapy commenced in children under 5 will be maintained in the over 5 age group. So that's good news for those that get the treatment. But a child at present at 11 that I described, where does that child stand? Where can she go? Where, as I said, her body is marked with injection sites. Her family see the huge benefit that an insulin pump would provide in terms of lessening the amount of injection sites. And where does that child stand? And other children like that, I'm not sure how many there are in the country, but I'm dealing with a specific case, someone that has asked me, and where does that child stand? Because it is at the minute, if the child is 4.5 and the treatment comes along, that's fine, that child will get the benefit, but a child of 11, where do they stand?
Thank you. Minister.
I suppose that, and you can understand well the parents' concern in terms of their daughter, especially at that very delicate age of 11, possibly approaching 12, 13. And, you know, without diabetes, that brings a degree of worry anyway. But we have to start somewhere, Deputy, and children that will get the insulin pumps who are now under 5 will be maintained into later years and adolescence in terms of the insulin pump. Whilst I have every sympathy, I don't think I can genuinely comment on a particular individual with diabetes, but I do understand the concerns, and we have to start somewhere. And just like with various vaccination programmes, it would be our aim to do a follow-up and a catch-up programme as well. And I will speak to the Minister for Health about this. I think it's important, and I do know the value of a treatment process, especially with diabetes, where it is a daily event. I do know the benefits that an insulin pump brings. It relieves the type of constant worry that there is in terms of, you know, the amount of insulin and when it's to be given, and especially when you're talking about children, that sort of routine that they don't normally have. But I will speak to the Minister about a possible catch-up programme. Not certain we'll be able to deliver it, but I think it's something we should seriously consider. Thank you.
Minister.